If you or somebody you know suffers with a wound that just will not heal, and quite often this is associated with diabetes, but there are other causes, you know how unbelievably frustrating this can be, painful, and all the problems that go along and are associated with that. Well, a local company may have found an earth-shattering solution here. I've got Adrian Pelkus with us today from IYIA Technologies from San Marcos. One of his patients, Mike, is here as well today. Adrian, fill us in. What have you discovered here about getting wounds to heal that have not previously responded to other treatments?
Well, what we've discovered is that along the lines of history, there's been some great methods of healing. Water baths, oxygen, but they're rather crude and primitive compared to what we've done. We've discovered that if we really tailor the practice of hydration and oxygenation, we can increase the rate of wound healing 3 times faster than anything that's been seen before.
Now, frequently in the past, this has been done with things like hyperbaric chambers and so forth in extreme situations. And Mike, in your situation, and we'll talk about your condition in a second, right. Did you try some of these other treatments, like the hyperbaric chambers?
Yeah, they wanted to put me through hyperbaric treatment, and the infection was so bad that it had to required amputation. And it was at that point where I started to look for alternative treatment because they wanted to give me a below-the-knee amputation, and I was not ready for that at this point.
You just weren't ready and you were looking for other treatments. So
Absolutely.
How did you find IYIA Technologies then?
Well, I did a little research online and found Adrian's company and looked at the research, and it looked very promising. Went to my doctor. She prescribed the treatment for me because I had some terrible wounds on my foot, multiple wounds.
Now, I'm going to warn people right up front. You brought in several pictures, yeah. But I'm going to tell folks that we're just going to show you one, and I'm told, I haven't seen it yet myself, that it is pretty dramatic. So let's take a look at what the condition was that you were dealing with. Okay, this is the machine itself, I understand.
Yes, it is.
Okay.
That's the Omizly.
Omizly, is that?
Omizly, right.
Omizly.
O2 Mysli. It blends oxygen with a mist. These are photos of some of our patients. This gentleman was a 42-year-old diabetic, and he couldn't get a pancreas or kidney transplant for years. He had this wound 6 years, I believe. We treated him within 6 weeks. It completely healed. Not only did he go on to get kidneys, he became one of the world's first pancreatic transplant patients up in Irvine.
Oh my! Okay, now we're going to take a look at Mike's. Again, I warned you, folks. It's pretty graphic. Okay.
This is Mike's before and after.
So,
one of the nicer befores.
Yeah, one of the nicer befores, yeah. Like I said, we had others. And then the after, I see pink, healthy tissue there.
That's right.
That's amazing, amazing. What is it that causes these wounds in diabetics? And why won't they heal?
Well, there's a lack of circulation is the normal problem. The whole thing starts with neuropathy. You don't feel you have a wound, it festers, it becomes infected, and then since you have poor circulation, your body just can't heal it naturally. What we do with our methods, the hydration opens up the microcapillaries, so we start seeing natural blood flow when there usually isn't any, and then we bring in pure oxygen, and we mix oxygen, so there is still a complement of oxygen, because you need oxygen. Your cells have receptors, and when they receive that oxygen, they create the growth hormones that create angiogenesis, the healing effect.
Now, how do you get away from doing the hyperbaric treatment then? How do you really infuse the wound with the treatment here?
What you're seeing right now, this chamber, it's a bag. We fill the bag with a adiabatically humidified mist, a very fine mist. It doesn't make you wet. And then we have a built-in oxygen concentrator, and we pump pure oxygen into that bag. And so it cycles back and forth between a mist that opens up the microcapillaries and the oxygen that goes in and hits it. So it's an outside-in rather than inside-out treatment as far as the oxygen is concerned, and at no pressures. A lot of the problems with the hyperbarics are the chamber gives you claustrophobia, the ear pressure in the eyes. It's
very uncomfortable. It's an uncomfortable treatment. If you're at all claustrophobic, you really don't want to be anywhere. Right? You're smiling, Mike. Are you a bit claustrophobic?
I am, and even MRIs or anything like that, to sit in that for an hour or 2 hours is unbelievably terrifying.
So this is a big breakthrough here, folks. And again, IYIA Technologies right here in San Marcos. You're such a big believer in this that if I'm reading my notes right, you basically offer folks a guarantee that I've never heard anything like it, especially in the medical profession.
Well, that is correct. We're so confident because of our studies and our results that we're offering, now this is for private pay, but if you're not seeing the results we're expecting, in other words, if you're not healing in 2 weeks, you don't pay. And we are the first device manufacturer that I know of to offer this kind of guarantee.
Never heard anything like it. Well, look, Mike, thanks for coming in and sharing.
Sure.
Adrian Pelkas from IYIA Technologies. If you need more information, and you didn't get it there on your screen, folks, I know you're going to be pounding their door down now that you've heard this. So for you or for somebody you know or love, for more information, you go to san-diego6.com and you click on San Diego Living. Again, it's IYIA, IYIA, IYIA Technologies, right here in San Marcos. Guys, thank you so much for a great success story.
Thank you.